We're proud to announce CISO Stories, a new podcast series in partnership with Cybersecurity Collaborative and Cyber Reason. CISO Stories features the candid perspectives and experiences of frontline senior security executives and dives deep into timely security topics. CISO Stories is hosted by Todd Fitzgerald, VP of Cybersecurity Strategy at Cybersecurity Collaborative, and Sam Curry, Chief Product and Security Officer at Cyber Reason. Listen weekly as they speak with extraordinary CISOs by visiting securityweekly.com/CSP.
Welcome back to the HIPAA edition of Security and Compliance Weekly. Hey, Security Weekly is more than happy to announce that we will be at InfoSec World 2021, which will be held in person October 25th through 27th, 2021. This year, our annual partnership with InfoSec World is extra special as we're both business units under the Cyber Risk Alliance brand. What does this mean for you, the Security Weekly listener, and InfoSec World attendees? It means you'll get to see and hear from many of the Security Weekly team at the event, and you will save 20% off on your World Pass. Visit securityweekly.com/ISW 2021 to register using our discount code. Also, if you want to stay in the loop on all things Security Weekly related, go to securityweekly.com/subscribe to subscribe on your favorite podcast catcher or our YouTube channel, or you can sign up for our mailing list. You can join our Discord server, or you can follow our live streaming platform, Twitch. All that fun stuff. All right, let's get back to the discussion. I wanted to reset a little bit and try to focus a little bit on the security aspects of things for at least a minute. You referred to what I'm hearing is there's a lot of goals of implied security, data security within HIPAA. What actually are the specific security requirements? How, are they HIPAA themselves? HIPAA because it's a federal thing? Do they point to, God forbid, I mentioned NIST documents? What do companies actually have to follow? And part two of that question is, who enforces it? I see everything through a PCI lens where, third parties have to come in and independently assess whether a company is following all the security requirements within the PCI data security standard. Compare and contrast, if that makes sense, or just what is involved when an organization has to do HIPAA, from a security perspective, from security requirements. Tell us a little bit about that.
So HIPAA is a little bit of both. So they do kind of mandate best practices. They make reference to things like HIPAA standards, but part of HIPAA is what's known as the HIPAA security rule, which is actually part of the law that outlines a specific set, outlines a set of controls. They call them safeguards under HIPAA, but there's administrative, technical, physical, organizational safeguards, as well as some requirements about documentation you have to maintain related to those things. So policies, procedures, outputs from audits, and that kind of stuff. Unlike some other compliance schemes, there's not actually a certification body for HIPAA. There's no requirement that you be audited and that you get third party to sign off and say that you are HIPAA compliant. Most organizations want that, however, because it helps to demonstrate that they did the due diligence necessary in the event that a complaint is lodged against them with the Office of Civil Rights, which is the federal agency that's responsible for enforcing the HIPAA itself. So we've talked a little bit about HIPAA security, and that's codified within the HIPAA security rule. HIPAA also has a couple of other related rules that are worth talking about. One of them is the privacy rule, which is kind of the other half of the major piece of HIPAA that talks about what those covered entities we mentioned before, so healthcare providers, insurance organizations, and clearinghouses, what they can use health data for, what they need patient consent to use health data for, and what they can't use it for without the patient consent. That's all under the privacy rule, which also says that you have to apply safeguards to protect the privacy of the information, but not just its security. There's also the breach notification rule, which is worth noting that's where the HITECH added those higher penalties that was mentioned earlier, but it's essentially what says if there's a breach of protected health information, the covered entity has to notify the patients affected, notify the federal government, and potentially notify the public if the breach is over 500 records. And you have 60 days to do that. So 60 days when you find out, not 60 days when you decide that it's a problem. And there's also the enforcement rule, which is kind of what pulls in OCR and actually empowers them to go after folks with those civil and criminal penalties we mentioned before.
But companies they're not reporting to OCR that they're compliant. That's not OCR's function.
Right. It's not required.
Who is typically, or what entity or organization or individual is typically going to OCR and saying, I've got a problem with XYZ healthcare company?
For the most part, it's patients whose data was breached, because they're the people who can say, hey, I was harmed by this, and so they could go to the Office of Civil Rights and they can file a complaint.
Okay. And they do that? They know that they can do that? Do they band together and do that? Do they get lawyers involved? How does it work?
The answer to all those questions is yes.
Yes. Okay.
Some people do that. Some people do it because they're upset and disgruntled, so they're looking for any way that they can go out and harm the organization or do whatever they need to do to get whatever they see as justice. There, other folks will contact a lawyer first, and the lawyer will usually advise them to go do that as a first step. For example, sometimes they're told to do it because they'll go to the healthcare organization themselves. They want to lodge a complaint, and the healthcare organization will say, here's HIPAA and the rules, and maybe refer them that way too. But yeah, so people get there through lots of different ways. Then there's an online portal you can use to lodge the complaints and that kind of stuff. And in fact, the OCR keeps HIPAA also has this provision for publicizing the enforcement actions taken by the government. So you can actually go out to the Health and Human Services site, and they actually have they call it the Wall of Shame, which is kind of the colloquial term for it. But it's a list of all the organizations that have done those mandatory reportings, and it's updated daily. I mean, if you go look now, there's stuff just reported within the last week for organizations that had reportable breaches that they have to deal with.
Yeah, and if you feel you need to make a complaint, here's the URL right up here above me. This one. Go there. That's where you start your journey.
Yep. And Jordan, just to clarify, I'm kind of curious. I mean, does it have to be an actual impacted party? So does it have to be a patient? It was my understanding that even external researchers, or even more so internal whistleblowers, can also file complaints.
Yeah, I think anybody can file a complaint, but I'm not sure everybody has maybe the. Yeah, to be honest, I'd have to go look up the details there. I'm not sure what it is. I know it's not just the patients. To your point, independent researchers, anybody that has a feel that the organization isn't meeting their obligations under HIPAA can probably make the report, and I'm sure that would be investigated if it looks reasonable. But I'm not sure exactly what the limits are. I'd have to actually go look them up.
Yeah. Jordan, I'm kind of curious, as we were talking about just some of the high level rules, I was actually, what can we talk about from just a pragmatic standpoint? Like, what should practitioners, especially on security teams, kind of be aware of? When I think about, other regulations like PCI, et cetera, we kind of have some broad frameworks of which people actually understand, like, oh, hey, create a PCI zone, tokenization, et cetera. What are some of the pragmatic things that, security teams should be thinking about today when it comes to HIPAA?
Absolutely. So that's a great question. So HIPAA itself, the security rule at a high level is you need to assess the reasonably anticipated risks to EPHI and take steps to address them. The security rule outlines specific things that organizations need to have in place, and these could be those things that organizations should be looking at today. Things like access control for PHI, making sure that only the people who need access to the healthcare data in order to do their job can actually are the only folks that can access that data in order to do their job. There's even some additional rules about who's accessing which records and when. And we should talk a little bit more about privacy monitoring in a bit, because that's kind of one of the big gap areas in healthcare space. But access control. HIPAA has a whole specific section about workforce training. So not just the typical security awareness training everybody goes through, but actually telling people, good hygiene practices. HIPAA requires that you tell people how to select good passwords, for example. That's actually one of the elements that's supposed to be part of that education that's included in the security rule. You have to train your workforce and actually evaluate your controls periodically too. So like I said before, you have to assess the risk for reasonably anticipated threats to PHI. You have to periodically revalidate both from an administrative standpoint. So have you selected the right controls? Do you have the right procedures in place? Do you have the right systems in place? And a technical perspective, hey, you've implemented a firewall. Is it really protecting your network? You have to test those things. That HIPAA requires that as well. It requires physical safeguards to protect the equipment. So this isn't just keeping workstations from being stolen, but it's also about there's some provisions in there about making sure that these systems are, that everybody or the people within an organization uses to deal with PHI are actually themselves in an area that's secure and controlled access and stuff, so that somebody couldn't, shoulder surf or walk up behind somebody and just, get access to records because they left it unlocked, for example.
I love your last point there, and it's actually something I would love to actually dive in and get your perspective on, especially since we're still dealing with this global pandemic, and that's been requiring people to actually work from home. And I'm actually kind of curious, like, how you think about this idea of working from home combined with people actually dealing with PHI and some of the HIPAA regulations. Is it even possible for somebody to actually be dealing with HIPAA data and also working at home and be compliant at the same time?
So yeah, the short answer to that question is absolutely it's possible. So one of the things that people may not have recognized before everybody was working from home from COVID is that entire classes of healthcare workforce, so a lot of times medical coders, so the people that are actually responsible for making sure that your medical bills and the things that your insurance is being billed for actually meet those standards for sharing that information we talked about before, as well as transcriptionists. So your doctor dictates into a system, and if there's an actual person that's transcribing that information, as opposed to these days it's done by computer programs usually, they've been working from home for decades.
Yep.
So let's talk about that real quick. With us coming out of the recent pandemic, point blank question: is it a prescribed HIPAA violation if an employer or somebody else asks to see a COVID vaccination card?
No, they're not a covered entity, and as a patient, you can always say yes or no, but it's not a HIPAA violation for them to ask that question. It may violate other state confidentiality rules. So, for example, in the
depending
states of depending on the state. So, like, one of the things that I had a recent discussion with a classmate about has to do with the definition of medical practice in the state of California, state of Washington, and they were talking about how they were going to a restaurant during the COVID era, and before anybody could enter that restaurant, they were taking customers' temperatures. That's actually practicing medicine and against the law in the state of California for them to do that, at least as far as we could tell. But asking for that information is not necessarily a HIPAA violation. It would be a HIPAA violation if your employer called your doctor to ask for proof that you weren't infected with HIPAA and your doctor gave them the details without your permission. That would be a HIPAA violation.
Yes, because being infected by HIPAA.
Yeah.
Perfect. So if you guys don't mind, I sort of want to bring together a lot of the issues that we have noticed inside of HIPAA. And in doing some of the research before getting on the show, I came across an article that I'm going to put up in the Discord. And if you're not in the Discord, then you're missing out on the article. But it does a really good job at codification of the challenges that we're seeing for HIPAA. And more specifically, the technical challenges, the administrative challenges for HIPAA compliance, the physical challenges for compliance, risk analysis, and policy and procedure documentation challenges. And you had mentioned earlier about access control and dealing with policies. And, that's part of the subsection, but that technical challenges for HIPAA compliance really breaks down into access control, audit controls, data integrity, and data transfer, right? So how are you working with clients to understand access, audit, data integrity, and data transfer while hitting all of the other areas like under physical, secure facility, workstation security, device security, versus the administrative, which you were talking about earlier, which is training, establishing process, security control, oversight, and ongoing assessment? How are you manipulating the multiple bullseyes so that way you can throw the dart and have it hit all of those to be able to protect clients? Like, what is the thought process there?
The thought process there has to do with the fact that under the security rule and the privacy rule, HIPAA cares about who needs access to PHI in order to actually do their job. So it starts with the classic, I'm going to say role-based discussion, but it's not entirely role-based. We can talk about that in a little bit. But the idea really is understanding who needs access to it, what they need access to, and where they need access to it. That's where you start. Once you understand those pieces, then it starts getting down to, okay, so we know where and what they need access to, and we need to know how they're going to get access to it. And that kind of informs what other decisions and controls we need to place getting at that physical security stuff like we were talking about before, or like I mentioned before, or the kinds of access controls that need to be in place. On top of that, that auditing requirement is something, and I mentioned before, that's kind of a common gap in the in the HIPAA world, and it's because traditionally security auditing is about monitoring user activity. So users are, the principles for, on a system that touch different things. In the HIPAA world, you have to be able to tie that activity back to a person, not a user account, but an individual person. And it's not just that you need to track the activity that they're doing on a computer system, what actions they're taking, what data they're touching, that kind of stuff. You have to actually be able to determine, is their access of that specific patient's record appropriate or not? Or are now we talking about privacy rule violations? I often work with organizations to talk to them about, look, you're familiar maybe with security monitoring because you're PCI compliant, or maybe you've got an ISO validated or certified security management system, whatever else. Let's talk about how we expand that into privacy monitoring, because that's an area where it's a little bit harder to draw the correlations between user account activity and the data that a person is looking at. But it's really, really important. Some of the most egregious HIPAA violations that have been in the news recently have been things like inappropriate access for maybe a healthcare provider was looking at the records of their friends or neighbors or that kind of stuff going back 10 years, and it wasn't noticed in part of their monitoring system because the activity didn't look malicious or unusual from a security perspective. In other words, they were a healthcare provider. They had access to that information. So it wasn't necessarily flagged as a security problem, even though it was definitely a privacy problem.
It's funny you'd say that, because there recently was a Supreme Court case where a police officer, and I think we actually talked about it on the show.
We did.
Where a police officer had access to their cruiser's computer, which means that they had access to the system, and then utilize that system to make money out of band of being a public servant. So is that really a misuse? Because according to the Supreme Court, it's not, because they have access to it.
So without getting into the details of that specific thing, HIPAA actually has a little bit different prohibitions against that kind of stuff than CJIS, the criminal justice kind of stuff, does. But yes, for a health provider to access somebody's patient health information that they have a technical right to do, but they don't have a need to do at the time or a purpose to do at the time related to caring for, or that they care for that individual patient, is potentially a privacy violation. There are exceptions. I mean, to everything. That the privacy rule has carve-outs for things needed to improve, healthcare operations. Some of the statistics I was talking before about, quality monitoring and improvement and workflow management and that kind of stuff. I mean, those exceptions apply in the healthcare space. Things for public health purposes, some research related to public health purposes and that kind of stuff. But for a doctor to it gets a little bit of a gray area, but for a doctor to compile a list of, say, their patients that have a certain, disorder like diabetes we were talking about before, right? It's allowable with consent for that doctor to use that data to talk to those patients about additional services that can help improve their state of care. But it's not necessarily legal for that doctor to take that information and then sell or give it to a third party to market to those people for unrelated reasons. And it's there's a lot of caveats about that whole arrangement there, but to your original question, it's probably a violation under HIPAA for somebody to do the same kind of thing.
Right. Now, I want to switch. I want to switch real quick over to the marketplace itself. Prior to HIPAA, this was not this was a known issue, but post HIPAA, we see a lot of companies that are trying to stay in compliance, but they're hitting challenges with the risk analysis of not enough manpower, not enough time. So time, money, budget, resources. That's always been a systemic issue. In the past couple of years, and here comes the question, in the past couple of years, have you seen businesses address the time, budget, money, resources problem, or are they just hedging their bet and saying, well, we're going with something like I don't know, Epic?
So Epic's a kind of an interesting example because Epic is incredibly expensive. But
what is Epic, real quick?
So Epic is a healthcare information system that works mostly for hospitals. So when you go to the doctor and they use a computer to deal with your records, to order meds, to treatment for you, for charting, for doing all of that kind of stuff, if you go to a hospital in the U.S., they're probably using, Epic or sometimes Cerner or other kind of system to do that kind of stuff.
Yeah.
Okay.
They're called EMRs, electronic medical record systems. They do a lot more than just the medical records, though. They do the medication, as you mentioned, and they're a full practice management system for hospitals, medical care, et cetera.
Yeah, practice health record management. I mean, they're huge systems, but that's kind of what those are. So, so back to your question, what I see is two kind of approaches there. One of the reasons we have a lot of problems related to HIPAA is some organizations maybe underestimate those resource requirements in order to meet the rules. HIPAA doesn't necessarily have a call out like in PCI. You can, if you can't meet a control and it's a legitimate business constraint for it because it's too costly, it doesn't, the risk is too low or whatever else. Risk is probably a bad example, but if it's too costly, you can devise a compensated control to meet that requirement, deal with it anyway. HIPAA doesn't really have that idea. It does have the idea that certain controls or certain safeguards required under the security rule are addressable, which means you don't necessarily have to do exactly what's in the law, but you have to do something to address whatever that thing is. It doesn't mean you can ignore it. It means you have to do something. So
right. So are you seeing companies like devote time, budget, money, resources towards this, or are they just hedging their bet and saying we're gonna push our risk off our dock?
So I've seen folks head down the route of relying on cloud service providers to offload the need to do some of that control. So cloud-based EHR systems, not Epic necessarily because Epic isn't cloud-based, but some of the other ones that are, so that the management of that aspect of the system is actually outsourced to a third party, which is one of the ways that they've been able to save a lot of kind of money constraints there. On the other side, it's not that folks have just put off assuming it wasn't going to be a problem. I think this is a classic example of it's going to be too costly. They don't fully understand or think it's going to matter to them, so they ignore it and let somebody else make that plan for them. It's not necessarily an informed choice not to do anything, I think, fully informed choice, but often those things are let to go because from a healthcare provider's point of view, especially if they're a doctor who has a private practice or they're smaller organizations or whatever, it's not the primary, it's not why their organization exists. It's not the primary thing that they do. I have seen some organizations stay completely on paper records because it reduces the amount of things that they have to comply with. It just complicates things and prevents them from being able to deal with third party, with other healthcare organizations and insurance companies and that kind of stuff as well.
Flea, you had a question?
Yeah, it's a two-part question, Jordan. Coming back to something a little bit more pragmatic, I'm actually kind of curious. I'm just going to put you on the spot here. What would be like the top 5 things that you think people misunderstand about HIPAA? And then also, what are kind of like the top 5 things you commonly see companies get wrong in the implementation of some of their controls?
Sure. So the top things that folks misunderstand and get wrong about HIPAA is, one, who it applies to. Some people think it's a general privacy regulation like GDPR or California's CCPA but it's not. It only applies to certain organizations who, as I said before, they create or they receive protected health information related to dealing with somebody. So there's a lot of kind of misunderstanding there. There's a lot of misunderstanding about, I mentioned before that HIPAA has some things in the security rule that are addressable. So in the security rule, the required safeguards are either required. In other words, you have to do what the law says specifically related to protecting that thing, like access control and that kind of stuff, or they're addressable, like encryption, for example. If encryption is the best way to protect the confidentiality and integrity of PHI, then you should do that. But if it's not the only way to do it, if you can rely on better access controls or something else, you don't necessarily have to encrypt the data. That's anyway. The details there matter later, but. Some people think, some organizations for a long time thought that, well, if a requirement was addressable, that meant it was optional. It's absolutely not optional. You have to do something to achieve whatever the goal of that safeguard was. those are probably the most important or most common misconceptions about HIPAA. One of them is I'll say it's about kind of both things. That's both a common misconception about what HIPAA requires and something I see a gap a lot, which is what I mentioned before, that activity monitoring and that logging piece. A lot of organizations, especially in the IT world, understand that from a system activity and a security monitoring perspective. But a lot of health organizations don't necessarily take that a step further to do adequate privacy monitoring. In other words, are your staff accessing only the records they need to for the right purposes? A classic example there is, are you checking that the providers in your organization, for example, aren't accessing patient records with the same last name as the provider? Are they looking up their family members, their kids, their neighbors, that kind of stuff? When they're not, shouldn't be, because they're not the ones treating those patients. Are they looking up the records for patients who have the same address, either as one patient or another? There's a certain kind of another rule in HIPAA. And this one's a little less gotten wrong, but it's kind of related to that same thing, which is VIP patients. So it's possible under HIPAA for a patient to do what they call opt-out, which is basically to say, I don't want the health organization to disclose even that I'm here or what my condition is, that kind of stuff. So like when you hear on the news and they say, the person's in the hospital and they're in satisfactory condition. There's a specific, HIPAA actually allows health organizations to actually identify the person's last name, their first initial, the date they were admitted, their general status, so satisfactory, critical, otherwise,
alive,
and the date
dead.
they were admitted.
Yeah,
basically.
Okay.
Yeah.
That is a status, yes.
It is.
Yeah. The basic status. Yeah. Dead or alive would be a status, I suppose. But looking up records for those VIP patients, if you are a healthcare worker or just another employee, it could be an operational worker like a environmental services or food services, something in a hospital, and that, famous actor is staying there, Robert De Niro or Jeff Mann or somebody that's really well known is staying there. Looking up their records when you're not part of treating that is a privacy violation under HIPAA. And healthcare organizations, I think, even today, misunderstand the fact that they actually need to be on the lookout for things and take reasonable steps to prevent their people from doing that. It's not enough to say, our folks aren't going to do that because they're good people. That's fantastic, but you have to be able to back that up somehow.
What I'm hearing is, go ahead, Flea.
Oh, no, I was just kind of, just want to take it a step further because, HIPAA just seems like something that's really, really poorly understood in the industry. And I'm kind of curious, where would you point somebody towards who actually really just need help and actually really kind of get them further educated on HIPAA, better ways to actually implement some of these things in a practical standpoint inside of their organizations? Sure.
So the best place to go that I've always sent people to first is actually Health and Human Services website. They have a link on their website specifically related to HIPAA for individuals, for patients who want to learn more about it, and for professionals who want to learn more about it. And the government doesn't always do a very good job of describing these things, but as these pages and as the information I've gotten has evolved over the past, HIPAA was the HIPAA law itself was passed in 1996. Enforcement for the first provision started in 2003. It's been around for a while, and they've done a lot to make that information more consumable, more readily available for folks. That's probably the best place to start. There's a lot of other online resources, but to be honest, I haven't found any of them that are as comprehensive, as well described, or as succinct as what Health and Human Services actually publishes themselves, which is probably the one and only time I'll ever say go to the government agency first.
If you get nothing out of today's episode, remember that.
That's right. Yeah. If you go to hhs.gov, of course now they've buried the lead. It used to be right on the top of their page, but if you go to hhs.gov/HIPAA, and that's HIPAA, not HIPPA, you can see links to specifically to HIPAA for individuals, that link for filing complaints right there on the main page, all that kind of stuff. And that's probably the best place to start.
What I'm hearing is, and I tie everything back to PCI just because I'm more familiar with PCI. It sounds like where HIPAA is, and organizations that are needing to do HIPAA, where they're uniquely challenged is we tend to think of the big compromises, the big breaches. How many years ago was it when Anthem got into trouble because they lost all their PII? It wasn't even necessarily technically a HIPAA violation, but we tend to think in terms of protecting the systems and protecting the the storehouses, the warehouses, the databases of all the data, whereas it seems like HIPAA is a lot more focused on individual, 1Z, 2Z compromises, misuses and abuses and disclosures of data. And that's challenging. I think that's what we're getting at.
I mentioned before that a lot of other privacy regs kind of tie some of their ordinance back to HIPAA, and a lot of that gets down to the fact that the reason HIPAA mandates security for protecting PHI and the privacy rules for ensuring it's only used for the things it's supposed to be used for is about protecting individual people from being abused or having their information stolen. It's not about the system. It's about the individuals and the understanding that data is highly sensitive. It's things that people care a lot about, and we need to treat it accordingly. And that's kind of one of the underlying premises on that. And that's one of the, as you said, that's one of the big differences, is that it's not about the data, the records of the data. It's about the people affected by it.
Wow. Any other questions from any of my illustrious co-hosts? Very cool stuff. Thank you. You've given us
actually, I do have one more question.
Please.
Obviously, I'm this is a subject I really like. And there are pathways for people who actually want to get into the world of PCI, doing audits and things like that. I'm actually kind of curious, like
assessments,
assessments. Having dealt with people that do HIPAA assessments, I'm kind of curious, like, what would somebody need to go through for them to actually effectively get at your level, Jordan? And if they actually wanted to go into the world of being actually do HIPAA assessments, like what are some of the things that they should be looking into? Where can they get additional training? Those kind of things, et cetera.
Sure. So the resources on the HHS website, like I said, are kind of a good place for anybody to start that wants to learn more about HIPAA. I would kind of turn this one a little bit on its head in that there aren't a lot of good third-party education programs dedicated to HIPAA compliance. Somebody mentioned HITRUST before. I forgot who said that. They're a private organization, kind of a partnership with a bunch of healthcare organizations to create more of that HIPAA compliance standard. Not just HIPAA. HITRUST is cross-standard. That's not necessarily a bad place to start. It's a great idea. But it's also super expensive.
It's also really, really fucking expensive.
Yeah. And maybe overblown for smaller organizations. One of the elements that is really, really important for HIPAA is if you've already got some security skills and you already understand the technical side of stuff there, go work in healthcare. Healthcare is an interesting business in that there are competing, often conflicting, dual objectives for a business. It's not just about a profit and making money. It's about saving people's lives. And sometimes those two things are conflict with each other. And you have to gain an understanding of what that looks like and when you make which decisions. And you're not really going to get that outside of working in healthcare itself. Most of what I understand, especially about the practical applications of this thing, is because I worked for providers, because I was in that space. And it's also one of the reasons that there's not a lot of really good training programs for that kind of stuff, because it's not enough to focus on just protecting the information itself. As we said, this is about protecting individuals. Need to understand that perspective. So that's kind of my opinion on the subject. I'm sure there's other people out there that can point to specific classes. There's a lot of universities now offering courses in healthcare informatics. There's even some certification programs in healthcare informatics that will touch on security and risk and privacy concerns. But in my experience, none of them have been as effective as being an IT professional, an engineering professional, a security professional working in healthcare and seeing it from that perspective. It's one of the few areas where getting your hands dirty is the best way to understand how to prevent them from getting too dirty later.
So what about somebody who works for a mobile carrier that deploys 5G? Does that count as healthcare?
No. Healthcare.
No, that's a vaccination site. That's what that's called.
Too soon. Jordan, I think you've given us some final thoughts, but I will give you one last moment to give us any parting nuggets of wisdom.
Sure. Kind of to Flea's question earlier about common misconceptions and common things that are got wrong. One area to spend some time about, and I feel like especially these days we can't focus enough on this, is the impact of ransomware on healthcare organizations, because it seems like every other week we hear about another one getting infected with ransomware. So two things. First, HHS released guidance with Office of Civil Rights a while back that yes, a ransomware infection is potentially a reportable breach if you can't prove that the bad guys didn't actually have inappropriate access to the health data, because if they've encrypted it and they control it, they have unauthorized access to it, and they've taken your control for it to use it for unauthorized purposes. So that matters a lot. The second aspect of that has to do with, we've harped a lot in the security world on this idea of least privilege access and that kind of stuff. Well, HIPAA is one of the few areas, or with health data specifically, where if somebody doesn't need access to it, or you don't need to be storing it on one system, don't do it. That can help limit the impact of ransomware spreading through your environment, because if Joe user gets infected with ransomware and they don't actually have access to the other systems, so the ransomware can't spread to their back on the EHR systems, well, guess what? You've protected the patient information, maybe the viability of that business too. So getting those kinds of least privilege things right the first time can be a really, really important step in preventing that from happening, in addition to training users and patching systems and all of that kind of stuff. So we didn't spend a lot of time on the ransomware side here, but yeah, it's getting kind of nuts, and people need to take it a little bit more seriously, I think.
Well, I'm okay with that, because that's been kind of in the news lately, and it's been a popular topic, and I didn't want to just be a retread and be yet another venue for talking about ransomware. There's plenty of resources out there for that. I appreciate that we've gone down different avenues, and hopefully have given all of our listeners, and well, I can speak for myself, I've learned some things today. I think all of us as the co-hosts, we've learned a little bit. So
Absolutely.
Jordan, thank you so much for joining us today and giving us an opportunity to focus on an area that we hear about all the time, but at least on this show, we haven't really talked about a lot. So appreciate you coming on. Time for us to get back to work. Take care.